All right. Happy whatever day of the week it is, Thursday, everyone. Welcome to AMCHP's bi-weekly COVID MCH town hall. I'll start my video so you can see. Hello, I'm Amy Haddad, AMCHP's Director of Public Policy and Government Affairs. First and foremost, I'll start off with greetings from Jonathan Webb, our CEO. He normally joins and moderates these meetings. He's unable to join us today and sends his regrets and asks you to be kind to me as I attempt to moderate instead. For our agenda today, we'll be doing a welcome. I'll give a very quick legislative update, as well as a quick update on an AMCHP operational survey of membership on COVID response that we've done. Then we'll turn it over to Dr. Warren from MCHB. We're pleased to be joined by two new guests from CDC today, and then, of course, ample time for Q&A as well as state sharing. And I just did something that I'm going to need someone to fix. Thank you. So, very quickly, many of you may have seen there have been no new legislation passed by Congress since the last time that we talked, but there was a big bill introduced on Tuesday this week by House Democrats. They call it the HEROES Act. It is the next iteration of what the House sees, or they should say House Democratic leadership sees as necessary for responding to COVID. It's a huge bill. It's definitely been kind of dismissed right away especially by Republican members and the Senate. So I would say it's more of Speaker Pelosi's first move in laying out what priorities are, but we know that there are long ways from negotiations. I will point out some highlights in this bill include ample funding for state, local, territorial, and tribal governments. There's funding in there for a public health workforce loan repayment program. There's funding in there for expanding support for MCV, home visiting, for WIC, for SNAP, for family leave, a number of other provisions. Like I said, I won't go into all the details right now, but it's a good marker to say right now that we can respond by either saying, okay, these are the things we like about it, or these are the things that didn't make it in that we want to see, and that's how AMCHP will approach its future advocacy around this and very near future. We're not waiting too long to respond to it. But even with the House most likely passing this bill, maybe even as soon as tomorrow, although there's some progressives who have some concerns, maybe they won't pass until next week, although I think they're looking at tomorrow. There's still a long ways until this becomes final law, and negotiations are still continuing with the Senate. So even if you see news that it passes tomorrow, it's not, everything that's in there is not going to be in a final bill. Now I will quickly go over the results of the AMCHP operational impact survey that we did. Thank you to our colleague Cheryl Clark at AMCHP who ran this. We had about 2 weeks, I believe, open for responses, and we got response from 50 of 59 states and territories, which I think is really great, especially considering we know how busy you all are because you told us in this survey. One question was about work environment. So it looks like most of you either have all or more than half of your staff teleworking, but there were a few of you who also responded that there's fewer program teleworking and even program staff still working in your offices. The vast majority of states have Title V program staff deployed to COVID-19 activities or functions. I think we'll be interested to hear a little bit more. I know I've heard from some states where Title V staff have been deployed as contract tracers, for example, but it's really interesting for us to understand how your public health departments are utilizing Title V staff, and especially, I know I'm curious to know whether it's to serve in an alternate role or to provide MCH expertise in other settings as your state is responding to COVID-19. Funding support, mix here. Most of you are using Title V block grant dollars, and there's been a mix of also state and federal general dollars as well as emergency crisis response funds. And finally, some pressing needs that continue to persist, whether they are, COVID-related contact restrictions, and we know that's really important for some of the direct services that are provided, hiring, if you've either had staff who are redirected to COVID response, or you're unable to backfill other positions that have been open, technology needs for both your staff or the populations you serve, and concerns about funding. What comes next? We expect state budgets to be strapped with loss of revenue. We aren't sure yet what FY21 appropriations are going to look like overall. So we know that's a real concern. So thank you again. I think we'll be finding ways to disseminate this more broadly, but that really helps us get an idea also from AMCHP and hopefully our federal partners as well on how we can best serve the needs that you're facing during this time. So now I will turn it over to Dr. Warren, the Associate Administrator for the Maternal and Child Health Bureau. Thank you.
Thanks, Amy, and good afternoon, everyone. Appreciate, again, the opportunity to be here. I want to thank our partners at AMCHP for hosting. I think this is the 4th call now. These are so helpful to us as we hear from you and hear about ways that we can support you and about things that are emerging in your states and territories that we need to be aware of. So if we can advance to the next slide. Just a heads up, wanted to let you all know for planning purposes now, we are not going to be convening an in-person partnership meeting this fall. You all know that the plan for the recent years is that in the fall we pull together folks for our partnership meeting, typically in the DC area. We won't be doing that in person, but we will be doing a series of interactive webinars in partnership with AMCHP over the course of the coming fiscal year to do some of that engagement with you for dialogue and peer learning that we typically do at the partnership meeting, and more information will be coming. But we wanted to make sure you could go ahead now and plan on not having to think about doing that trip in person. Next slide. Just a reminder, on the last call, we had just released our telehealth funding. There was $15 million that went out. This was part of funding that came through the CARES Act, and MCHB was able to award $15 million. A bucket of that is related to pediatric care that went to the American Academy of Pediatrics. Part of that was focused on maternal health care, which went to the University of North Carolina at Chapel Hill. Family Voices received an award for family engagement, and AMCHP received an award for state public health systems. And the ultimate goal of these programs is to help providers and families both prevent and respond to COVID-19. So next slide, please. I wanted to give you a little bit of an update on the AMCHP portion of that, the portion that was for state public health services and systems. So the award to AMCHP was for $4 million to expand telehealth access and infrastructure. And there were really 3 broad buckets of things that we hope to accomplish in partnership with AMCHP with this funding. The first is generally enhancing the use of telehealth and distant healthcare services in Title V programs. The second relates to newborn screening, and the third to home visiting. And so really excited to work with AMCHP. They've got such a strong record of success. Look forward to working with them in the next few weeks to finalize the work plan and over the coming year to implement those activities. They are 1-year funds. We do have some flexibility to adjust as this response evolves, but we are really excited to start this work with AMCHP and partner with them around these 3 areas. Next slide. Just want to close by saying again, thank you. Please let us know please let us know if you have questions for your MCHB funded grants. The questions have slowed coming in the last few weeks. I think many folks got their questions answered early on, but if you still have questions about grant flexibilities or deadlines or changes in work plans, please reach out and let us know. As I've mentioned on prior calls, there is a lot of flexibility that we have right now. That's a general statement, so I would encourage you to reach out to your project officers and see what you can do related to your particular grant or program. But rather than sort of sit and worry, please just reach out to them. They would love to hear from you. They're happy to help you. And so let us know if you have questions. If there are things that are emerging in your states or territories that you want to make us aware of, please don't assume that we know. And if there are ways that we can be supportive of you from the Bureau, please just reach out. And with that, I will close. Thank you.
Great, thank you, Dr. Warren. So now we are going to turn it over to Dr. Wharton from the CDC. I will have you introduce yourself and thank you for joining us today. Are you able to unmute yourself?
Yeah.
If you
Thank
want
you. Can you hear me? So thank you. I'm really delighted to have a chance to talk to you all this afternoon. The COVID-19 epidemic is impacting so many aspects of life, and one of the things that's happened is that as these stay-at-home orders went in place and people became concerned about the safety of leaving their home, that they didn't take their children out for well child visits either. Next slide. This is a figure that was that we published in Morbidity and Mortality Weekly Report last Friday, showing the decline in vaccine orders for the Vaccines for Children program, which is our large federal program that provides federally purchased vaccines for eligible children. And what these lines represent is the difference in VFC orders by week for all non-influenza vaccines for the week this year compared to the comparable week last year, and for measles containing doses in the dashed line. So that there was not much difference at the beginning of the year, but then beginning in mid to late March, a precipitous drop soon after the U.S. national emergency was declared. Next slide. And it wasn't, can we go to the next slide, please? Oh, I must have not, okay. It's not just that the orders went down, we have good evidence that coverage went down as well from a variety of sources. So in order to get immunization back on track, there's a number of things we know that needs to be done. We're actually very concerned about the immunization delivery infrastructure. Many primary care practices, especially small ones, don't really have the enough fiscal resilience to make it through a prolonged period where they're not seeing patients or not seeing many patients. Many have had to furlough staff. I got a sort of heartbreaking email from a pediatrician in New York State who reported that he hadn't been able to pay his rent for 2 months, had laid off all of his staff, and that's what's going on for many primary care practitioners right now. So we are concerned about the delivery infrastructure and concerned that there may be providers who previously were concerned about those losses both on the public and the private side. We do rely on the private sector for the delivery of most vaccines through the Vaccines for Children program, and if those practices close or choose to no longer participate in the Vaccines for Children program, there will be gaps for eligible children. It's also important that we plan for safe delivery of immunization services in both public and private sectors. Providers are making changes in their clinical practice. I just got an email about 15 minutes ago from the pediatrician who took care of my children when they were younger, and about the way they have structured their service delivery so that it's safe for people to come in. It's going to be very important that missed visits are made up, that catch-up doses are given, and the way we do that in immunization is through reminder recall, reminding families that they're due for a visit, recalling patients who have missed a visit and are overdue. So that's what needs to be done. And And I think as far as AAP is concerned, the single most important thing is to encourage parents to contact their healthcare provider to get that missed visit rescheduled and come into the office and make sure that the child stays up to date. Next. So we are working with partners to disseminate messages about the importance of well child visits and recommended vaccines, coordinating with the response to incorporate messages about routine childhood vaccination into COVID-19 communications. And we really hope to work with partners to disseminate information about the VFC program to families that may have lost insurance coverage, which is part of the reason I was very excited about the chance to talk to you all this afternoon, because it did seem like the MCH programs were well positioned to do this. Next. And this is a visual from some of our digital materials that we've used for our social media. Next. And I have just a couple of slides about VFC, which I expect is that you all are familiar with. But just briefly, it was created by Congress in the 1993 Omnibus Budget Reconciliation Act, implemented in 1994. So the program is actually now 26 years old. And it's an entitlement program funded through the Medicaid Trust Fund. CDC provides vaccines that are purchased with federal dollars. CMS covers vaccine administration fees for eligible children through Medicaid, and all ACIP recommended vaccines are covered and available to eligible children. Next. The eligibility for the program are for children through 18 years of age who are Medicaid eligible, uninsured, American Indian or Alaska Native, and certain underinsured children who are seen in federally qualified health centers and rural health centers. Approximately half of young children and nearly 1/3 of adolescents historically have been entitled to VFC. We're expecting that at least in the short term, there may be some increases due to the numbers of people who are now unemployed and may have lost their insurance. Next. And this is just a screenshot from our website for parents about the VFC program. The URL's there at the bottom. Next. I think that's it. So I appreciate the chance to talk to y'all, and if there's time at some point in the call, I'd be happy to take some questions. Thank you.
Yeah, before I turn it over to our next presenter, there was one question that came through, and I will ask for participants, if you want to ask a question, can you try to type it to all panelists and attendees so that all attendees can see the question. But we have a question about what indicators should a parent look for in order to be reassured that it's safe to come in for well child visits, and what should parents be aware of to ensure the safety of clinicians and staff? I don't know if it's something you can address, Dr. Wharton, or if any other partners want to address that.
Well, I can start it. I think actually my colleagues from the response may be better situated to address this than I am. But I would encourage parents to just talk to their provider. I mean, what I heard from my pediatrician a few minutes ago was how they have separated in time well and sick visits. Other providers who are parts of, say, multi-site healthcare systems have sick visits at one facility, say in one building or one set of offices, and well visits somewhere else. Providers have been very creative in coming up with solutions for this. AAP's provided good guidance, and I would just encourage families to call their provider and if they've got questions to ask.
Great, thank you. So now we will turn it over to Dr. Chatham-Stevens, who's normally with emergency response at NCBDDD, or emergency preparedness, excuse me, and at the Center for Birth Defects and Developmental Disabilities, and right now is deployed at the At-Risk Task Force, if I am getting that correctly. So turning it over to you.
Hey, thanks, Amy. Appreciate the opportunity to chat with y'all. Yeah, so I do pediatric preparedness when not involved in the response. And as Amy mentioned, I'm currently on the Community Intervention and At-Risk Task Force as part of the COVID-19 response. And I just wanted to thank everyone for the opportunity to connect with you all today, both to kind of share some updates from our task force, but also to learn from this group, which we consider such an important partner for CDC. So in the interest of time, I'll just try to briefly cover two topics this afternoon. The first is I'd love to provide a brief update on some recent reports of multi-system inflammatory syndrome, or MIS, in children, which you may have seen is a hot topic in the news these days. And secondly, I'll share some new communication resources and web pages that our task force has helped develop. And I do not have any slides in case folks are wondering. So first off, I wanted to chat about this multi-system inflammatory syndrome in children that's potentially associated with COVID-19. CDC is aware of the reports from Europe initially, and then subsequently here in the US of these cases. You may know that in early May, some public health officials in New York State, New York City issued health alerts describing some of these children who are hospitalized with MIS, some of whom were severely ill. Most of these patients described in these announcements did test positive for COVID-19 sometime during their illness. And since the health alert has been issued, more suspected cases of MIS in children have been reported here in the US. And just briefly, a general overview of some of the symptoms of MIS have been described as inflammation across many body systems, including the heart, lungs, kidneys, brain, and gastrointestinal organs. And hence its preliminary name at least, which is multi-system inflammatory syndrome. And here at CDC, we're trying to collaborate with a variety of domestic and international partners to better understand the syndrome, including its prevalence and risk factors, and really trying to establish a system to help track these cases. I think one example of this is we're partnering with the Council of State and Territorial Epidemiologists, or CSTE, to issue a national call for cases on MIS via a CDC Health Alert Network, or HAN, message. So those are just some brief updates on that. I think this is a prime example. We always say that this is a rapidly evolving situation, COVID-19, and I think this is a prime example of a particular aspect of the response that is changing very quickly as we, on a daily basis, get new information on this very important topic. And so we hope to be able to update you all as we go forward on that topic. And so now I'd like to pivot a little bit and chat about some of our newly released or newly updated materials that can be found on our websites and social media channels. I think one in particular that you all may be interested in is an updated web page titled "If You Are Pregnant, Breastfeeding, or Caring for Young Children." And I'll just run through a couple of the major sections on this web page and kind of highlight some of the major messages in those sections. So there is a section titled "Cloth Face Coverings for Children, Parents, and Other Caregivers." And one of the main messages here is to not put cloth face coverings on babies or young children, or children younger than 2. There's also a section, I think this dovetails very well with Dr. Wharton's presentation, that's on prenatal and postpartum care during the COVID-19 pandemic, and really emphasizes that people should keep their prenatal care appointments and postpartum appointments as needed, and not to delay getting emergency care because of COVID-19. I think we've seen some indicators that people may not getting emergency care at the same level as they were before the pandemic. There's another section on vaccines during pregnancy and the COVID-19 pandemic, recommending that people get their vaccines, and also face shields for newborns and infants. You may have seen in the media over the past couple of weeks, there have been some very cute pictures. I think one in particular from a hospital in Thailand that showed a newborn wearing a plastic face shield. While that is quite a cute picture, I think a variety of folks have numerous concerns about the use of these. And so that's highlighted in this new webpage, that these plastic face shields for newborns and infants are not recommended. So definitely check out that page at your convenience. A couple other things that we wanted to highlight, I think, mental health, social behavioral health those have been major topics during this response. And, Google and CDC had a collaboration last week that culminated in some web postings on Saturday regarding this Be Kind to Your Mind initiative. And that really focused on some practical, very simple tips that we can all take to improve our mental health during this pandemic. And so there were a variety of messages posted on Twitter, Facebook, and Instagram on behalf of CDC, and also via Google channels as well. So check out those if you're so inclined. We also posted a new animated video on grocery shopping and cleaning and disinfection. The grocery shopping one is based on like how, once again, provide some simple practical tips on how to go to the grocery store and be as safe as possible. And it was an extremely well done video, so please check that out as well. And one other thing that we posted last Friday was a considerations document for public pools. And I know there's been a lot of attention in this particular topic as we approach summertime. And so this is one of our first guidance documents or considerations document that will entail an entire portfolio. And this one really focused on tips that owner-operators of pools can use, but also people who go to pools can use to stay safe as pools begin to reopen. And so, we are developing a variety of other setting-specific guidance documents, everything from schools and institutions, higher learning, summer camps, faith-based organizations, youth sports, those types of settings and activities. And a lot of these really use some of the same or similar themes. And so you'll see those kind of peppered throughout these various documents, regardless of the setting, really. And I just wanted to run through some of those real quick. We emphasize, to stay home if you're sick, and that applies to employees, but also, shoppers or participants in the activities. Protect the vulnerable. As someone who's involved in pediatric preparedness, we often talk about vulnerable or at-risk populations, so we definitely want to protect those individuals. It emphasizes telework and flexible leave, promoting good hygiene, implementing social distancing, cleaning and disinfecting, because a lot of the cleaning and disinfecting recommendations are the same regardless of the specific setting. And also hoping to provide lay-friendly and culturally competent materials. And also, if someone is sick, to send them home. And once again, that goes for a member of the public as well as employees. And so these are just a couple of examples that we wanted to share of materials that are on our websites and in our social media feeds. As you probably know, we're continuously updating these web pages and social media channels. So please continue to check back on those. And if there's anything in particular that you think is missing, something that you or your stakeholders think needs to be added, please reach out to us. I think one of the best things about opportunities like this one to speak to you all is to hear if there are things that we're not providing that would be beneficial, and we always take those types of comments back to our folks who are writing the guidance materials and our folks who are doing our communications materials. So with that, I will end. Thank you very much for the opportunity to speak.
Great, wonderful. Thank you so much. Lots of great information there. I know that many of us have been reading those reports coming out of especially New York, but now I see many more states and have been concerned, as well as all the great resources. I hope everyone saw we put those in the chat if you want to link to them, or you can just click on those links for more information about the various resources being put out by the task force. So now we have a nice half an hour left of our scheduled time to open it up for questions on any topic we've discussed or anything else you want to share. I'm going to start by posing a question about telehealth, since that's, as Dr. Warren was covering earlier in the call, the new funding that has been released, and AMCHP is excited to partner with our members and as well as the other grantees to make sure that we're leveraging this in the right way. So one question I might ask is if states feel like you are already and or have the capacity to assess what the telehealth needs are in your states, Are you working with other partners in your public health agencies or otherwise? I think we'd love to hear if you're willing to share what, like I said, what you see as your ability to do those assessments, if you are already doing those, or if it's something that you might need extra assistance with. As you're thinking about that, please feel free to ask any questions or chime in about any of the topics that we've discussed today and for our panelists as well. You can also unmute yourselves and you can type questions. Make sure that you type them to all panelists and attendees. And I see Becky from Louisiana says that Louisiana has already assessed and rolled out. Would you be willing to share a little bit about what that's looked like?
Sure. First, our home visiting team was the one that went first. They were more ready. They had less to deal with when it came to Medicaid reimbursement, since we aren't covered currently by Medicaid. So it really is all a programmatic expense. So they looked into what was available, what the models would allow for telehealth, any exemptions that were being made. And within a couple of weeks of moving to work from home, we did roll out our home visiting MCHB telehealth. And with that, we've had really good success in that we're actually able to reach people that we had trouble reaching before with the home visits in person, especially because more people are at home during the day. So we're getting people who worked, and we're also reaching people who were just hard to reach due to disparities. So that's been a kind of a silver lining to the telehealth rollout. For our children and youth with special healthcare needs programs and our reproductive health services that we provide, it took a little bit longer to roll it out. That rolled out probably, it's been out now for about 2 weeks running. And for that, we had to work out reimbursement and which codes to use for Medicaid for telehealth, and turn things on in our electronic medical records and a lot of other pieces just to get ready. But I do think we had a really good, strong plan, and I can ask Amy Zapata if she'd be willing to share our rollout plan with AMCHP, just to put it out there, because we had revenue involved, we had our health system strategy manager involved, we had our clinicians involved, and we had in the public health units, and then we also just had the programs that run these, all involved in the conversation about what would be needed to be able to roll this out. And then we are building into some patient satisfaction surveys and also provider satisfaction surveys to see what their experience with telehealth has been, and helping them with some TA from some of our staff as well. So with the readiness, I do think it's just making sure you have the right people at the table. And we decided not to do children with special healthcare needs separately from reproductive health, because it was a lot of the same providers and it was a lot of the same conversations with Medicaid. So I think having the right people at the table and asking the right questions is really key.
Wow, that's great. And I'm laughing when you said that it's been a little slower. We've only been at this for really a few weeks. So that sounds like you guys have really gone above and beyond in Louisiana. And I know that we will be really interested in any insights you have to share as AMCHP prepares to work with other states and, facilitate peer learning on telehealth assessment and readiness as well. So thank you so much. And
no problem.
We'll be following back up with you. Jacqueline asked if there's any specific plans to include children and youth with special health care needs. And so we are still working out what our plan will be, but absolutely keeping the SHIN population front and center is obviously a top priority for us. We also are in conversation with some of the organizations that serve more directly to families with children with special health care needs. For example, Family Voices also receive some funding through the same mechanism, and also we'll be working with partners to address concerns around things like newborn hearing and screening follow-up. So I don't know if that answers you enough. We don't have a detailed project plan yet. That's forthcoming, but again, happy to follow up with that on future calls that we have. Thanks, Jacqueline. And then I see Kay has shared that there were listening sessions with pediatric providers from FQHCs and children's hospital clinics, and those will be presented on a webinar next week, 1 week from now, and there is a link to register. Thank you for sharing that. Kay indicated we learned a lot about their telehealth challenges and innovations, and also heard about variations in Medicaid payment and response. I know early on that was something we were hearing from our members as well. There are some really great resources about the variation in Medicaid payments and the way telehealth visits are being reimbursed. There's, I think it's updated almost daily from CMS, information about what's covered. A lot of restrictions have been lifted regarding which providers can bill to Medicaid, which services can be billed to Medicaid. Cheryl Jones shares Child Health Specialty Clinics in Iowa is providing services to your children and youth with special health care needs via telehealth, and mentioning that Iowa has loosened some reimbursement, I'm assuming requirements during the pandemic, and I will get that CMS link. Are there any other questions that folks want to pose? I see Kay writes, there's Medicaid information from Georgetown and that. Yeah, there's a lot of info, and I will be, like I said, I will find that link for the CMS information as well. I think NASHP has also done some work on this. Any other thoughts on telehealth that you may want to share? We know that some of the issues that are being faced, are around both the access and training for providers on how to conduct visits. We know there's variation in what providers are willing to do. I can tell you from personal experience, my 3-year-old was supposed to have her well child visit. Her birthday was in March, so she turned 3. Since there were no vaccinations needed, our pediatric provider said they were happy to do it by televisit, but I've spoken to other friends whose pediatric practices aren't offering that option, so they're either delaying or waiting for them to be set up with the capability. So I just, I know a lot of it first depends on where your provider's office is at, never mind where the folks at home, parents, what your familiarity with technology may be, because sometimes even the instructions, right, for like downloading those apps can be difficult. Oh, Meg, thank you for sharing that. I think that's probably what I was going to be looking for. Well, I'll move on, and of course, just feel free to ask about any topic while we're talking, and especially while we have our esteemed partners from CDC and MCHB, if you have any questions directly for them. Another topic that we had wanted to talk about a little last time and didn't really get to as much was about easing of restrictions. We're curious to know, are any of you all part of your state's planning in response to how and when restrictions will be listed? And feel free to take yourself off of mute. Everyone is able to take themselves off of mute. We have a question. Did we share how states are doing teleaudiology or hearing screening in homes? Great question. Does anyone have any information to share about that? We have not shared anything about that, and I haven't personally seen, but if any of my AMCHP colleagues or our federal partners have any information to share on that.
Gary, this is Michael from MCHB. I will get with our EDI folks and ask them if they have been talking, our newborn screening folks generally have been talking both on the metabolic side and the hearing screening side. And so I can see if they've got examples to share with you, and I'll ask them to circle back with you.
Great, thank you. We can send as a follow-up as well.
We're seeing in Nevada that NEIS follow-up.
Sorry, Vicki, it's a little hard to hear you.
Sorry, we are seeing impacts on the NEIS ability to the early intervention follow-up being impacted with our EDI program, not the hospital processes.
Sorry, I think you were saying that you're seeing an impact on follow-up from Eddie. Maybe, are you able to type it into the chat? It was just hard. I'll wait for Vicki to respond, but I also see a question about dental screenings. Is there anything that folks are doing regarding dental screenings and oral health during this time? And if not, I will add that to our list for topics to cover next time as well. I know that I heard regarding hearing screenings, I might put on the spot. I don't know if we have anyone from New Mexico on today, because I know you were one of the first I heard from about challenges with even getting the initial hearing screenings done. And then also welcome Jenny from Hawaii, mentions that in partnership with the university and Hawaii Public Health Institute, you've been promoting telehealth across communities since the onset of the pandemic.
Amy, this is Kathy from Parents Reaching Out, and I'm sorry I don't have any information regarding the hearing screenings that probably came from Susan Chacon.
Okay.
Thanks.
Amy, this is Trevy Brown from HRSA.
Hi, Trevy.
Hey, how are you? Good to see your face. About the hearing screening and the teleaudiology, we at HRSA are working with our National Technical Resource Center, which is NCHM, infanthearing.org. I'll post it in the chat box. My understanding of the teleaudiology is that that can't be done in the home, but they're certainly exploring different approaches there. So, and we are working with all our EDI coordinators to address issues related to these delays in the screen. So we are capturing that information. So if anyone wants more information, I'll provide the link to our Technical Resource Center, or you can reach out to us at HRSA.
Thanks. Trevy, would you put in the chat just the link to the Resource Center as well as the right email to contact or contact phone number?
Yeah.
Thank you. Appreciate that. We have another question about guidance on reopening schools. And you've seen that AAP has provided some, and then different states are creating their own guidance for reopening. Right here in Maryland, I just saw like a 100-page report from the Department of Education that, as far as I can tell, basically says here's 100 different scenarios on what we might do with the schools, and we can choose to implement one of these or none of these. So even when there is guidance being released, sometimes it's hard to wade through it all. Does anyone from CDC have anything they can share about guidance on reopening of schools at this time?
Hey, this is Kevin Chatham-Stevens again. So yeah, I think as I mentioned earlier, there's a whole portfolio of considerations, documents that are in the pipeline. The first one that came out last week was on pools, but subsequent ones will include a variety of different settings, including K through 12 schools, as well as institutions of higher learning, I believe. So I can't give a specific timeline for when exactly those will be released, given the thorough review process that they're undergoing right now. But I would definitely say be on the lookout for those. And all these considerations documents will provide a range of options and tips that folks can implement for each of these settings to make sure that each of these settings is being reopened in a safe manner. So we will definitely share more information about these types of guidance documents or considerations documents as they're released. Thanks.
Wonderful, thank you. And hopefully if any of them are available before the next call or for the next call, we'll do that then. And of course, my neighbor is mowing their lawn right now, as is customary during calls that we're speaking on. So I'm going to mute. Okay, if it's not a neighbor mowing the lawn, it's a child or a pet, right? All right, Jerry Matson says, I've heard of audiologists doing home visits to do hearing screening for those who need hearing screenings. Do you have any more information to share about that, Jerry? And you can unmute yourself or type it into the chat. While we're waiting, just pointing out, and also for those of you who may be on the phone, Treaty did share some information in the links. So if you need any of those, please feel free to contact me or Jess Cohen, who you get the email reminders for these calls from. We can send those to you. I see a message from Jenny. A lot of concerns from dental providers in preparation for opening their practices. Many guidance have been released for the medical community, but not necessarily the dental community, and needing more support for dental providers. I think, you know, it's interesting. I think we will look at if we can have someone who can address more about follow-up on dental and hearing screenings in this time, because it seems to be a topic of interest for many of you. I don't personally have an answer. I don't know if MCHB or CDC have any information about guidance for dental providers.
Hey, this is Kevin from CDC. It's not our task force, so I don't want to step on their toes and talk about their activities, but I do know one of our fellow or sister task forces does have a variety of guidance documents for dental settings. I'm looking at one right now that really focuses on infection prevention and control guidance for these types of settings. I can certainly reach out to them and see if they are planning on developing any other types of guidance documents as we begin to reopen. But this particular document is definitely aimed towards dental clinicians.
Maybe if it's helpful, we could also, so MCHB funds National Technical Assistance Center for Oral Health, as well as the one that Treaty mentioned for hearing. So we could, she provided those resources in the chat box. We could also get the oral health ones for you all. And if there's interest, we could think about how to further share information on that.
Great, thank you. We can do, I'm looking at you, Jess Cohen, from AMCHP, to help make sure that if we can compile any of those resources, including all the links that have been shared in the chat, especially for those of you who called in and may not be viewing this on a screen, we will make sure to find a way to send all of the resources that are being shared. And I'll ask MCHB and CDC if you have any resources that we've talked about that you can follow up with us after the call. Okay, Jenny shares from Hawaii, the school nurses released a free telehealth triage hotline for students. That's great. Responding to the dental providers, just wondering if they don't also have the PPE, and we all know that it's been a challenge for some to receive it. But Lynn from Utah says they do have some recommendations for dental providers, and you will send what Utah has developed. Thanks, Lynn. We will make sure to send that to everyone. There's a lot of thank yous for that, and thank you, Dr. Tyler Stevens, for sharing the CDC dental settings recommendations. Wonderful. A question about the link to the student telehealth hotline from the NASN, I'm assuming it's National Association of School Nurses. And I know Jenny was talking specifically, I think, about Hawaii. Do you know if it's something that's also being implemented on a national level? Is anyone familiar with that? If not, we will look into that as well. Just Hawaii. Okay. Jenny, do you have information that you can share about the school nurse offering in Hawaii? and wondering, but it would be a quite good question because maybe.
Yes, I do.
Okay, thank you, Jenny.
Yeah, I do. I have the hotline, and then let me see. Hold on a second. Sorry. Or I can post it on the chat, Amy.
Perfect, thank you.
Okay.
But it will be interesting. Actually, we'll look into that as well. Are other state chapters or societies doing the same? So
yeah, that will be good, because this is a partnership with our university system and the Hawaii DOE. So
excellent. And also reaffirming the importance of making sure that there's collaboration across health and education agencies. So important at this time, and especially thinking about, I know a lot of us are thinking about talking back to school openings, what some of the enduring health and mental health especially needs are going to be, that we're really going to be relying on our educational providers to be identifying and referring to when schools do reopen. We could probably have a whole other conversation just on that topic. We have about 9 minutes remaining, and so of course, keep asking questions on the various topics that we've discussed, but we always love to know, if you have something to share about even a success that you are really proud of in your state, or a particular challenge that you want to hear from your colleagues about. This would be a great time to share what you're doing. I'll go back. I tried to pose whether any of your states, as part of your planning and design for easing restrictions and reopening, if there's active involvement from MCH as part of that. And a comment, seems like an ideal time for MCH programs to have an active role in school health, childcare consultation, early childhood, mental health consultation. Absolutely. Dr. Warren.
Thanks. I want to piggyback on what Kay said, and I think our Title V and SHIN and family leaders across the country already do this well, but to reinforce you, this is the time to push your way up to the table. If you've not been asked to be at the table, raise your hand and say, hey, can I sit at that table? Because the MCH population often is not represented in a lot of these conversations, and you are the absolute experts in this work, so please push. And get yourself to those tables. If there are resources that you need from us in terms of information or technical assistance, please feel free to reach out. Many of you are already doing that. If you're not, I encourage you to get there, because otherwise it's really easy for folks to leave out the MCH population. So we and the population at large rely on your voice to be at those tables where folks are thinking about service delivery or reopening considerations or any of a number of issues that are coming up right now.
Thanks, and thank you to Janice Gonzalez in New Mexico, saying that you had to get yourself to the table, and it has worked, and that's wonderful. And Kirsten Duckett, I hope I pronounced your name correctly. Can you tell us which state you're from and what role the MCH staff has been playing? From Ohio, thank you. Do you have anything else to share about the role that you've been able to play, or how you got involved in those conversations? And in the meantime, Janice, can I put you on the spot as well to talk about what you've been able to contribute to, or what forum you've been able to participate in?
Yeah, I've been working with our new early childhood department a lot. We kept our childhood centers open. Initially, they were just for essential workers, and now they're open again for anyone who needs childcare. And so I worked with them on guidance, and we've, obviously as things change, we keep redoing the guidance, the health and safety guidance for the childcares. And now we're looking at summer programs and reopening some of those. So we have a meeting today looking at guidelines around that. And yeah, and and then our governor and the leadership there has been doing weekly briefings, and they weren't really talking about kids. So I sent them a briefing with a list of issues that we were seeing around kids with COVID. And yesterday, for the first time, they did have a section at their press briefing talking about children's issues. And so I'm just going to keep sending those briefings and hope that they use them.
That's awesome. And so I hope that's motivation for others who haven't been as sure about how to be invited to the table. And from Ohio, so some of the examples were various task forces to determine how to reopen the gym task force, a golf tournament, etc. Great. We have about 5 minutes left now. So again, I will invite, if there's any closing remarks from our federal partners, who I can't thank again for making yourselves available every other week. This is incredibly, I think, valuable to us. We've had pretty high attendance on these calls as well. So I hope that all of our members are finding value. Again, Jonathan, is sorry that he couldn't be here, and I think hopes to be available back for next time. But we are constantly, oh, thank you, Jenny is sharing more information about the nursing. Constantly seeking your input, because it's really important for us. We want to know how we can best help you. And so we know that when you're able to share, whether it's through regional calls or through just contacting AMCHP staff, we want to be able to make sure that we're getting you the right resources and connecting you with your peers in other states who are doing some pretty outstanding work during this time. We know that everyone's also stressed a lot on a personal level. And so appreciate, while we see a lot of people who might actually be working less during this time, all of us in public health are working a lot more than usual. And thank you, Meg, for the compliments. So I will leave the call open for another minute or two. Please make sure to register for our next call, which will be Thursday, May 28th. We have already scheduled time for the next 3 bi-weekly calls, so it's the 28th and then 2 dates in June. We'll continue these as long as you all want us to, and as long as we can convince our partners at MCHB and CDC to keep joining us. So again, just thank you again, and please fill out the evaluation, and that really helps us if there are specific topics you want us to talk about. I know for the next call, some things that we are already thinking about is maybe sharing some more information about the registries for pregnant and new mothers. And then I will also see what we can do about following up on the dental screenings, although it seems like there are some good resources that have been shared, as well as the school nurses. And my colleague Carolyn mentioned that we will be conducting some rapid scanning related to telehealth needs. So please look out for that as well, because that will inform how we can structure the new grant around telehealth. So on that note, I will give you back 2 precious minutes of your day. Thank you again for joining us, and we look forward to seeing you again in 2 weeks.